Laparoscopies are minimally invasive procedures in which doctors insert a trocar into the abdomen through small incisions. These procedures minimize the risk of injury and decrease the size of the incision. However, the smaller reusable versions pose certain risks for smaller patients. Warning: the following video contains a surgical procedure. To place the trocars, doctors will start by making a small incision in the abdomen. They are inserted by applying force and twisting motions. Once it is placed inside, the obturator blade can be removed and replaced with other instruments, such as a cannula, to pump CO2 in and create a bigger working space.
In the industry, reusable trocars pose a large issue for these small patients. Because of the child's small abdominal wall, the trocar is not adequately held in place, slides, and in most cases completely comes out of the abdomen. Dislodging of the trocar causes various complications. One of the most important ones is loss of CO2, which leads to decreased working space and increases the time spent in the OR. Many surgeons have tried to create their own solution by sewing a catheter sleeve to the abdomen. Their solution improves securement of the trocar and thus helps to prevent CO2 from leaking out. However, it increases OR time and scarring on the baby, while making it more difficult to adjust the height of the trocar. Finally, it doesn't even guarantee securement, as sometimes the stitch pulls out of the skin and the trocar can still dislodge.
Together, we have created an innovative, non-invasive accessory that solves many of the problems doctors face with trocars during laparoscopies. For all our inputs, we developed a testing protocol utilizing pigskin that approximates the characteristic of a thin abdominal wall.
First, the trocar device includes a silicone component to improve adjustability. Second, the adhesive at the base of the accessory secures the trocar to the abdomen. Third, using an adhesive instead of sutures, the insertion is 2.5 times faster per trocar and scarring from the stitches is eliminated. Lastly, the silicone adhesive combination improves securement of the trocar from both the original trocar and catheter sleeve accessory. During the procedures, the abdomen is inflated to 775 millimeters of mercury, and with our testing, the accessory perfectly seals to a minimum of 810 millimeters of mercury, surpassing basic surgical requirements.
Another device consideration is the dislodgement. Once again, compared to the catheter sleeve method, calipers were used to measure this and showed that our device had reduced but comparable dislodgement to both a standard trocar and a catheter sleeve retention method. Our device is intuitive and easy to use. The adhesive cover is easy to remove, and adjusting the height of the accessory requires much less force than the catheter sleeve.
The cost to manufacture each accessory is about $1. We tend to sell them at $5 each, making a $4 profit for at least 3 per procedure.
Overall, the greatest benefit that our device provides is decreased time spent in the OR. With TROCARE, we can make minimally invasive surgeries actually minimally invasive.